Welcome to Oncology Nursing Foundations for NCLEX Success and Compassionate Cancer Care. Cancer is one of the most complex and emotionally charged conditions you will encounter as a nurse. Every patient's journey is unique, but as a nurse, your role in providing evidence-based, holistic, and compassionate care remains essential. In this session, we'll explore oncology from both a clinical and nursing perspective, with a clear focus on what the NCLEX prioritizes and what you'll see in practice. By the end of this module, you'll understand how to assess, plan, and intervene for patients with cancer. And you'll have tools to confidently answer NCLEX-style questions based on this content. What is oncology? Oncology is the branch of medicine that deals with the prevention, diagnosis, and treatment of cancer. Cancer occurs when abnormal cells grow uncontrollably, evade normal regulatory mechanisms, and have the potential to invade surrounding tissues and spread to distant organs, known as metastasis. Why is this important for nurses and the NCLEX? Cancer affects 1 in 3 people in their lifetime. As a nurse, you'll care for patients with cancer across every setting, from acute care to hospice. The NCLEX tests your understanding of cancer pathophysiology, treatment side effects, infection prevention, psychosocial needs, and critical safety concerns, such as the handling of chemotherapy agents. What you'll learn in this session will cover core topics that you're expected to master for the NCLEX and real-world practice. First, cancer pathophysiology. How normal cells transform into cancerous cells, also known as carcinogenesis. The role of DNA mutations, oncogenes, and tumor suppressor genes. Differences between benign and malignant tumors, and understanding staging using the TNM system and grading. Next, risk factors and prevention. We'll discuss modifiable risk factors like smoking, alcohol, obesity, and UV exposure versus non-modifiable ones like age and genetics. Cancer prevention strategies, including screening, early detection, and lifestyle changes, and primary, secondary, and tertiary prevention, a favorite NCLEX topic. Moving on to clinical manifestations and the CAUTION acronym. The 7 warning signs of cancer, CAUTION, paraneoplastic syndromes and systemic effects of cancer. And recognizing signs and symptoms that require immediate nursing intervention. Then, diagnostic tools and staging. This includes biopsies, tumor markers, and imaging such as CT, MRI, and PET scans, plus TNM staging and its implications for prognosis and treatment. We'll also cover cancer treatments and nursing implications. Surgery, radiation, chemotherapy, immunotherapy, hormonal therapy, and targeted therapy. NCLEX critical focus on side effects and nursing interventions. Chemotherapy precautions, including PPE, handling, and extravasation. Radiation safety, considering time, distance, and shielding. And common side effects like nausea, fatigue, immunosuppression, mucositis, alopecia, and more. Oncology nursing priorities will be another focus. Infection prevention, such as neutropenia and ANC levels. Pain management and palliative care. Nutritional support, psychosocial care and family education. And end-of-life care and ethical considerations. Lastly, NCLEX tested concepts, delegation and prioritization, including neutropenic precautions and emergency symptoms like superior vena cava syndrome. Client teaching on managing side effects at home and when to call the provider. Safety protocols, including proper PPE when handling chemo or radiation materials. And ethical and legal considerations in cancer care, like advance directives, DNR, and informed consent. How this will help you on the NCLEX. Expect questions that test critical thinking, such as what is the nurse's priority, clinical judgment, like what intervention is appropriate, safety, asking what precautions are essential, and client education, for example, what should the nurse teach the patient? This module is not just about memorization, but understanding how to think like a nurse in cancer care. Assessing, planning, and intervening with compassion and confidence. Let's begin. Grab your notebook, and let's start by looking at how cancer develops and how your knowledge can make a difference. Cancer arises from the uncontrolled growth of abnormal cells. This process occurs in stages. Stages of carcinogenesis. Initiation. DNA in normal cells is damaged by carcinogens like chemicals, viruses, or radiation. Promotion. Mutated cells are encouraged to divide. This phase is reversible if promoting factors, such as smoking, are removed. Progression. Cancer cells grow uncontrollably, invade nearby tissues, and develop their own blood supply, a process known as angiogenesis. Metastasis is the spread of cancer from the primary site to distant organs. This can happen via the bloodstream, the lymphatic system, or through direct extension to nearby tissues. Common sites of metastasis. For breast cancer, common metastatic sites include the bone, lung, liver, and brain. Colon cancer often spreads to the liver, lung, and peritoneum. Lung cancer typically metastasizes to the brain, liver, bone, and adrenal glands. Prostate cancer most commonly spreads to the bone, especially the spine and pelvis. Cancers are classified by several factors, including the tissue of origin, anatomic site, behavior, histology or grading, and stage. Types by tissue origin. Carcinomas arise from epithelial cells, such as those in the skin, gastrointestinal tract, or breast. Sarcomas originate in connective tissue like bone, cartilage, or muscle. Leukemias are cancers of blood-forming tissues. Lymphomas affect the lymphatic system. Myelomas are cancers of plasma cells. Cancer grading, well, it describes how abnormal the cells look under the microscope and how quickly the tumor is likely to grow and spread. Grade 1 is well differentiated and low grade, meaning it resembles normal tissue. Grade 2 is moderately differentiated. Grade 3 is poorly differentiated. And finally, grade 4 is undifferentiated and high grade, which is quite aggressive. Cancer staging describes the extent and spread of cancer. The TNM staging system includes T for tumor. This indicates the size or extent of the primary tumor, ranging from T0 to T4. N for nodes. This refers to the involvement of regional lymph nodes from N0 to N3. M for metastasis. This indicates the presence of distant spread, either M0 or M1. Stage groupings are as follows. Stage 0, carcinoma in situ, which is localized. Stage 1, localized, small tumor. Stage 2 and 3, regional spread. Stage 4, Distant metastasis. Factors that influence cancer development can be divided into modifiable and non-modifiable risk factors. Modifiable risk factors include tobacco use, alcohol, obesity, or poor diet, sedentary lifestyle, UV exposure, occupational exposure. Non-modifiable risk factors include age, with older age equating to higher risk, family history or genetic mutations, such as BRCA hormonal factors, immunosuppression. All right, let's talk about cancer prevention. There are three main strategies: primary, secondary, and tertiary prevention. Primary prevention aims to stop cancer before it even starts. This includes smoking cessation, maintaining a healthy diet, and engaging in physical activity, getting vaccinated for HPV and hepatitis, and protecting yourself from UV radiation. Secondary prevention focuses on early detection. This means regular cancer screenings like mammograms, pap smears, and colonoscopies. It also involves self-exams, such as breast and testicular exams. Lastly, we have tertiary prevention, which comes into play after a diagnosis. The goals here are to prevent complications, reduce the risk of recurrence, and improve the overall quality of life. Early detection, the CAUTION acronym, a helpful NCLEX-friendly acronym to remember early warning signs of cancer. C, change in bowel or bladder habits. A sore that doesn't heal. U, unusual bleeding or discharge. T, thickening or lump. I, indigestion or difficulty swallowing. O, obvious change in wart or mole. N, nagging cough or hoarseness. Diagnostic tests: imaging, X-ray, CT, MRI, and PET, endoscopy, colonoscopy, and bronchoscopy. Tumor markers: PSA for prostate, CEA for colon, CA 125 for ovarian cancer. Blood tests: CBC, liver function, and calcium levels for bone metastases. Types of biopsies. Fine needle aspiration, or FNA, uses a thin needle to collect fluid or tissue. Core needle biopsy involves a larger needle to remove a core of tissue. Incisional biopsy removes a small portion of the tumor. Excisional biopsy removes the entire tumor or lesion. Endoscopic biopsy is performed during an endoscopy. Bone marrow biopsy assesses hematologic cancers. This concludes part 1. Next up, we'll dive deep into cancer pain, its causes, pathophysiology, assessment, and nursing interventions. We'll also cover types of cancer treatments, surgery, palliative care, chemotherapy, radiation, and the nursing care involved. Additionally, we'll discuss stem cell transplantation. And finally, we'll go through each major type of cancer, including descriptions, risk factors, assessments, interventions, and NCLEX relevant teaching.